Tennis elbow is a painful condition of the elbow that affects the outside of the elbow where the muscle originates. And that same muscle goes across the elbow and the wrist, so it affects wrist extension. Tennis elbow occurs in young active adults. It basically comes about from repetitive overuse of the outside of the elbow, be it tennis or be it, gardening or work around the house, painting even, localized trauma to the area. It also can be caused by improper ergonomics at your workstation too. So many different causes, but predominantly in tennis players. Typically the best way to diagnose is by a physical examination by your doctor, and where the doctor will examine your forearm and elbow and find pain on the outside of your elbow, which gets worse when you resist extension of your wrist against the physician who's trying to force your wrist down. Also, trying to pick things up with your palm down is a good indication, especially if the pain localizes to the outside of your elbow. There's a whole laundry list of different treatments for tennis elbow. Starting from non-surgical conservative treatment, we begin with first anti-inflammatories for the pain, and then also braces for both the wrist at night to be worn and for the elbow and forearm during the day to be worn. The next step in treatment after that would involve therapy, and we typically use occupational therapy, and it's a 6-week course of therapy with different modalities such as heat modality, iontophoresis, which is a transdermal way of getting medication to the area overlying the bone. There's also ultrasound therapy and different stretching and strengthening modalities. After therapy, if you're still having symptoms and if folks don't have time for therapy, we can offer them a steroid injection. And we typically do a series of injections. We start with 1 and we go up to 3 injections of the steroids. Other injections are PRP injections, which is short for platelet-rich plasma, and that's an injection of your own blood basically after you take the red cells out, and helps regenerate the tissue. Surgery is usually indicated after several months of treatment, usually up to 12 months of conservative management, because it's typically a self-limited process. About 90 to 95% of patients will get better with conservative management. The other 5 to 10% will need surgery, and you can go as soon as 8 months as long as patients have had the full gamut of conservative management, but typically we like to wait 12 months for surgery. As far as surgical treatment options go, basically you're trying to accomplish 2 goals. You're trying to take out the diseased tissue, and you're trying to potentiate new healing tissue. And we do that by excising that origin of the muscle and then drilling the bone and allowing new tissue to form in that area. We repair the tendon as well once we're doing that same procedure. Typically the recovery from surgery for tennis elbow or lateral epicondylitis is about 3 months till you're back to regular activities or sports that you were doing beforehand.